In cases of pulpal infections, do you think endodontic treatment is completed at the stage of obturation? What do you think about post-endodontic restoration? The primary objective is to prevent ingress of microorganisms into the coronal pulp. And beyond that, there are differences between the endodontically treated tooth and the normal tooth. There are structural changes, there are aesthetical considerations as the endodontically treated tooth loses its translucency and becomes discolored due to the necrosis of pulp and restorative material. Then there are also physical characteristics change due to the loss of moisture and brittleness of dentin after endodontic restoration. Due to these reasons, post-endodontic restoration has been considered, and it varies depending on the amount of tooth structure remaining. In cases where one remaining wall around the access cavity or no remaining wall around the access cavity, a post and core is preferred. So what is an endodontic post and core? Post is a relatively rigid material which is placed into the radicular pulpal region, which distributes the forces from the core to the radicular region. And core is that part which replaces the missing coronal tooth structure. It is usually a miniature crown and forms the center of the new restoration. So what are the types of endodontic posts available in market? We have prefabricated posts and custom-made posts depending on the method of fabrication. We have metallic and non-metallic depending on the material used. Non-metallic posts are usually fiber or zirconia posts, and depending on the shape we have parallel or tapered, and depending on the engagement with dentin we have passive retention posts or active retention posts. Passive retention posts are usually cemented posts and active retention posts are usually threaded posts. Then preparation of the post space is done with piezo reamers and Gates gluten drills. Why do we need to prepare the post space? Imagine post is a semi-rigid rod-like structure which is going to be placed inside the obturated space. The obturated space is already filled with gutta percha, so we have to remove the gutta percha which is inside to facilitate post placement. For the gutta percha is removed, leaving 3 to 5 mm of gutta percha for apical seal, that is up to 1/4 of the apical portion of the gutta percha is left undisturbed. The enlargement procedure is begun with the largest piezo or Gates gluten that will fit into the canal. Once the root filling is removed, consecutively larger piezo or Gates is used to enlarge the canal into desired dimensions. Initially, placement of post was thought to strengthen the tooth, but later it was found it weakens the tooth structure. The main aim is to retain the core and to redistribute the forces to the radicular dentin. Now, we need to remember something called as the Ferrule effect while preparing the coronal portion for post. What is Ferrule effect? Minimum of 1.5 mm of sound tooth structure 360 degree around the tooth should be present, and it is called as ferrule. It should be apical to the core and it improves the structural integrity of the tooth and prevents fracture. How do we fabricate a post? The post can be fabricated either by the indirect method or direct method. In the direct method, a loose fitting dowel is placed into the post space which reaches till the end of the post space. Then add resin to the dowel by bead brush technique. Check for the fitting, reseat the dowel inside the post space and add more resin before it polymerizes. In the direct method, any kind of elastomeric impression material is sufficient to reproduce the details. An orthodontic wire bent into J shape will provide the necessary rigidity to the impression material. After filling the post space with impression material using a lentulo spiral, an over impression is made with an impression tray. Pattern for the post and core is fabricated with a cast made as a result in the laboratory procedure using wax, and then investing and casting procedure is followed. Usually a parallel post is preferred than a tapered post because parallel post induces less stress due to less wedging effects and less fracture of dentin is seen, but more removal of dentin is necessary. Luting of the post to the post space is usually done with zinc polycarboxylate, zinc phosphate, GIC or resin modified GIC, but resin modified GIC is hygroscopic and usually not preferred. So what should be the ideal post length? For metal post it should be 2/3 of the canal space, and for fiber post it should be 1/3 to 1/2 of the canal. Regarding post space width or post diameter, there are three schools of thought: conservationist, preservationist, and proportionist. The conservationist suggests that the narrowest space should be prepared for the post. Preservationist suggests that 1 mm of dentin should be maintained circumferentially around the post space, and the proportionist suggests the narrowest diameter of the post should be 1/3 of the root's diameter. As we saw earlier, core is a miniature crown which forms the center of the coronal restoration. Available for core buildup include dental amalgam, dental composite resins, resin modified GIC. What is Richmond crown? This is a one-piece post crown. It is indicated in patients with deep incisal overbite where it is difficult to provide space for a core and crown separately.